right,
All right.
let's go.
All right.
Hey everyone, exam 2.
Mm-hmm.
A child is transported to the emergency department by ambulance after telling his son he was, a client, I'm sorry. After telling his son he was thinking of swallowing his whole bottle of Prozac, which he has taken for several years. The client has a history of suicide attempts 20 years ago. The nurse initiates suicidal precautions and understands which concept about suicide.
So
I'm going with
Prozac is whatchamacallit. It's
A.
for panic disorder. It's also known as fluoxetine.
Mm-hmm.
I'm sorry. What was that?
No, I'm just specifying like what it's for, so we can kind
Oh,
of get
Oh, yeah.
an
I
idea of.
thought Prozac was an antidepressant.
Uh-huh.
I
Maybe
mean, I think it just indicated. I don't know. I believe it's
off-label
indicated for
use.
panic
Hmm.
disorder. It might
So
be
I'm gonna
used
go
more.
with A.
I think it's A too.
Really?
Which one do you think?
Oh, I'm sorry. I was reading this wrong. I thought it meant like their plan. Like the nurse's plan to like help them.
Well, I mean, which one do you think?
No,
Pain? I mean, what?
no, I agree.
No,
I
I agree.
think
A,
A.
yeah.
Okay.
Or well, right?
The nurse initiates suicidal precautions and understands which concept about suicide.
Yeah.
The most
Oh, okay. Yeah.
like
Yeah.
All right, A.
All right. In
All right.
planning the care for a suicidal client, which outcome criterion is of the most immediate concern?
Safety for sure.
Mm-hmm.
So not physically harm themselves. Express hope for the future. That'll come later.
Yeah.
Do you think it's
I'd say a
important?
trusting relationship because you want
Yeah,
to build
for sure.
rapport.
What do you guys feel about C?
I'm thinking about A.
A,
The
no,
most
A2
immediate.
because it's multi-select.
Well, how many though?
It doesn't say.
Doesn't say.
So definitely
But
safety.
if
So
it's
go
see, my
ahead.
thing is it's the most immediate concern. So like Michelle said, so safety, right?
Hmm.
So would you guys
Mhm.
think it's just not physically harm themselves because that's the most immediate concern? Or would it be like also trusting relationship?
God,
Most
you have to like
immediate?
build the trust.
Because you need to
So
build rapport.
yeah.
Sure. I mean, that's also correct. I agree.
But is that the most immediate concern, right?
No,
Like the
it's
most immediate
safety.
concern is making sure they don't harm themselves, keeping them
Right.
safe.
Yeah.
Right.
I think this is a trick. I think it's just A.
Okay,
What do you
Let's
think, Sydney?
what do you think?
I
Yeah.
agree.
Didn't you
I would
say?
agree, yeah. That is
Yeah, I
We
confusing
can
mean,
come back
though.
to it later.
yeah, what I'm finding is just A, just because of that word, like most immediate concern.
Usually it
Right.
says which is the top two or which.
Yeah.
Yeah, we're used to that with like farm.
Mm-hmm.
All right.
Because I mean, ideally, like obviously these are all important, like you said, Michelle, but like the
Mhm.
most immediate one is like they don't harm themselves.
Exactly.
Like it's
It's
their
like the hope,
safety.
yeah, hope for future that'll come eventually, reveal their suicide plan that might not be that immediate, like or needed. They also might
Mhm.
not be amenable to automatically like telling you you're a stranger. The trust has to come in time. So I think it, yeah,
All right.
just
All right.
say
I agree, yeah.
So we're good. We're good with A. All right.
yes,
That's
please.
yeah.
Next.
All right. A patient has disorganized thinking associated with schizophrenia. Neuroimaging will most likely show dysfunction in what part of the brain? I thought schizophrenia was the frontal. No,
I
it's
think
not.
it is.
Really?
Oh,
Isn't
I
it
thought it
it's
was
the
the
frontal
frontal.
lobe, right?
I thought she said frontal lobe, but now that like hippocampus is on here, it's kind of confusing me.
So frontal lobe, thought process, formulate, select goals, initiate plan, terminate action, decision making, insight, motivation, social judgment, voluntary motor ability starts in frontal lobe.
Hmm.
I'm in chapter 3, so
Yeah, I'm trying to remember. So I thought schizophrenia was a disorder
it's
of
chapter
the
12.
frontal
Let
lobe.
me go hit up chapter
Yeah, I
12.
was gonna say the PowerPoints that might have where'd it go? Oh.
Hey, it's a big one. Um,
I think the hippocampus is involved in emotions and learning. So I don't know if it would be a part of like disorganized thinking.
Mm.
It is disorganized thinking, right? Part of the
Yeah, and like delusions, hallucinations. They
yeah.
could be auditory, but the frontal lobe is more so memory, right?
So it says here, all people diagnosed with schizophrenia have at least one psychotic symptom, such as hallucinations, illusions, and or disorganized speech or thought. So where is that at? What part of the brain?
Disorganized speech and thought, I'm pretty sure. Hold on.
Ugh.
Frontal and temporal lobes in the parietal lobe. So schizophrenia research reviewed from 61 studies have found that disorganized thinking may relate to changes in certain brain regions such as the frontal and temporal lobe.
Okay.
So there's no temporal here, it's only frontal.
Yeah, I mean, we can go back to that one.
I'm gonna go
I mean, for now, I mean, we
Frontal?
guys just say frontal lobe for
Mhm.
now. We can come back. We can always do like frontal lobe, hippocampus.
I had all the
I
brain
had
things.
this,
What were
yeah.
all the brain functions were in 3, right?
4, I believe, is specifically schizophrenia.
But I want to here. Okay, functions of the brain. So the brainstem and the cerebellum are kind of like together.
Well, yeah.
They work together. So cerebellum regulates skeletal muscle coordination and control. Okay, it's definitely not cerebellum. Brainstem has the pupillary reflex, eye movement, your pons. So, major processing station in auditory pathways.
See, but the thing
And
with the frontal, oh, sorry. Go on.
But no, because I was just saying like they have auditory hallucinations. So
Mhm.
since the pons, that like is from the pons in the brainstem, but it's not the brainstem as a whole because it also has the medulla oblongata, which is that like, isn't the medulla oblongata like the lizard brain? You know, like have you guys heard that term?
No.
No.
Really? Oh my gosh. Okay. But no, I mean, yeah, this is like balance, heart rate. Yeah, I don't know.
All right.
I
Well,
think it's
we're
just
gonna
the
come back.
frontal, but we
So
can come back.
can move forward. So
Yeah, we'll
frontal
go. Yeah.
now. All right. Question 4. Go ahead.
A suicidal client is preparing for discharge. Which discharge outcome is most important for the nurse to consider?
Okay, so suicidal discharge outcome. They're being discharged, so it's no longer safety.
Yeah.
I think it's
Probably B.
Yeah,
I
right.
think B, yeah,
Yes.
because you want to make sure they're denying any
Denial of
of that.
suicide. Oh, okay. Yeah.
Most important. Yeah.
Mhm.
And implementing healthy problem-solving skills. Knowledge of
Yeah.
rehab resources. Mm,
Because like you said, Michelle, when they're being discharged, like it's been dealt with. It's no longer
Mhm.
safety is not as much of a concern. It's
Mhm.
so because they should have denied the suicidal ideation. They should no longer be suicidal.
Yeah, because that's the main reason why they're coming, and the
Mhm.
main reason that'll allow them to be discharged is that they don't have those thoughts anymore.
okay. B it is.
Okay.
Number 5. Go ahead.
When antidepressant therapy begins to take effect for a severely depressed suicidal client, the nurse finds that the client's mood improves and the client is much more communicative. Which nursing action is imperative at this time? So they're on severe depression, suicidal, but they're
So,
moving.
hmm,
Client is much
Which
more.
nursing action is imperative? Imperative.
well, I remember with antidepressant therapy, don't they have an increased, what is it? The
Yes.
like after like 3 weeks or something, like they have an increased risk of suicide even though they're on the antidepressants,
Yeah,
Mhm.
even if
because
their
as
symptoms
they're
are
working.
improving, right?
It's like as they're working, and like they take some time to take effect. Like it takes
Yes.
about like 3 weeks or so
Mhm.
for it to
So
actually.
you're trying to lean towards C by saying all of that?
Yeah.
The
Yes.
vigilance,
I mean, I
right?
don't think it'd be A because I mean, okay, it's not A.
What
Kind of-
No. Yeah.
I'm finding,
This time, what does the nurse need to do?
yeah, I think just increasing the vigilance is
Okay.
good
I agree.
because
So C,
Yes.
All
Yeah.
right.
I would either say C or D.
Recognize the client's suicidal potential has decreased.
But D, I feel like there's still like that
Actually-
risk of like the antidepressant therapy, like you
yeah.
said.
Exactly. So
It,
And
increase, it
C-
can increase the risk.
Yeah, and it's which action is imperative at this time.
and I think C.
See? Okay.
All right.
See, it is. Number 6. Which primary rationale substantiates why a full physical health assessment is warranted for clients with depressive symptoms? Mm. Mm. So it's not C.
You don't
Yeah.
think it's C?
I don't think it's C because
No. You think it's C?
I don't think it's C just because like the antidepressant therapy is not affecting like your
The
physical.
question is asking why a full physical health assessment is warranted. So why? The attention afforded to the client during the assessment is beneficial in decreasing social isolation. Physiological changes may be the underlying cause of depression, and if present, must be addressed. Possibly B,
I know I'm kind of between B and C actually.
and depressed clients are less likely to complain about their physical health and might have undiagnosed medical. Ooh, D.
I think it's D.
Is it D?
You think D?
Well, I just feel like depression can lead to like a decreased awareness of like your physical,
Health?
if that makes sense. Yeah.
No, I got you. Physiological changes may be the underlying cause of depression. I mean, that could be correct too. People who are, have cancer or whatever could be
But didn't we discuss the antidepressants?
sorry.
Like,
I'm sorry, go ahead, man. Go
don't
ahead.
the antidepressants have the risk to cause like weight gain? They can cause like
Sure.
high blood pressure.
I was gonna say I'm kind of I was forgetting about that.
So what are you leaning at by
Like
saying
that's why I'm leaning towards C because they
yeah.
do
C?
cause because they have the pretty substantial physical health adverse
Oh,
effects.
oh,
that they
you
can
know
cause.
what? You know what?
Well, let's go back to this one.
After
I
you
would say
saying that, physical health complications are likely to arise from antidepressant therapy.
yeah, that's
also-
a bit like I don't know if it's likely.
I know the wording is kind of messing me up.
All right. Well, what do you think? What do you want to put on right now until we come back to it? C?
What do you think, Sydney?
What do
I
you
think it's D,
I think
but
it's D.
clients are less likely to complain?
I know in like notes and everything, I'm finding it's C, but the wording is kind of. Let me read the question again. Primary rationale. Full health assessment is warranted for clients with depressive symptoms. Okay. When you are depressed, though, you might not be leaving your bed. You might be, not taking care of yourself. You might not be eating. You might not be, so like, or you might be overeating. So, that could lead to like what Peyton said, like weight gain and like other problems with your physical health.
I'm gonna go
You
with
might
D.
be-
I think that's D.
yeah.
Well, you just explaining it that way.
yeah.
Well,
Because like depression is like, if you think about it, it's fatigue, it's sleep disturbances, but those symptoms like could like attribute to like their mood disorder,
Other.
but it also is not recognized as like another underlying medical condition.
Yeah, I'm just trying to think about like us talking about in class how a lot of the time like people are hesitant to admit like they have like a mental issue, you know what I mean? And I feel like more people are more likely to go to the doctor for a physical health issue as opposed to like a mental health issue because of stigma, because of, whatever they might
Okay,
think,
where are you
maybe
trying to
it's,
get
like,
at? Which
denial.
A, B, C, or D? What are you trying to?
I don't know. I'm just kind of like trying to like talk it out.
Yeah, I'm trying to. I say for now, let's put D. I think we should come back to it though.
All right.
Because I could lean either way.
All right.
yeah, we'll make a note.
Okay.
Mental
All right.
7.
7.
Peyton, you want to read?
Yeah, sure. The Police bring a patient to the mental health unit. The patient was directing traffic and shouting rhymes on a busy city street. The patient's spouse reports that the patient has not slept or eaten for 3 days. Which assessment findings have priority concern for this patient's plan of care? I would say
So-
hyperactivity, not eating and
Yeah.
sleeping.
I'm thinking mania, you know,
Exactly.
they're not sleeping for days, they're, you know,
So,
shouting things.
so B, that's pretty
Yeah, I
straight.
remember this sounds kind of like the mania, like her daughter was like, I think she gave that example in class a couple weeks ago of her daughter.
Yeah.
Mania.
Mhm.
So which assessment finding have
B.
priority concern?
I'm
hyperactivity,
finding it's
Not
B.
eating and sleeping. Yes.
Yeah.
Mhm.
Okay.
Alright.
Number 8, a
Second.
patient with bipolar disorder is hyperactive and has not slept for 3 days.
Here we
Mood
go.
and behavior are labile. The patient threatens to hit another patient. Which response by the nurse is appropriate? So, mood and behavior are labile. The patient threatens to hit another patient. So, which one is appropriate?
Hmm.
Do not hit anyone.
I'm gonna go with
If you
C.
are
Yeah, I
able to
mean-
control yourself, we will help.
I'll go with C.
Yeah, I think C.
Pain
No,
management.
yeah, you can't because you're being like authoritarian if you're like stop that now, or like if you try that again, you know, blah blah blah.
Pain,
Mhm.
what are your thoughts?
It's like, who'd you say?
No, I was asking Peyton his thoughts.
Oh,
No, it's yeah. I'm just trying to
No,
figure
no,
like what wording seems most
say it.
appropriate,
I
right?
mean-
Like most therapeutic. But I guess in that sense, like you're not really being therapeutic if they're
Which one,
threatening
C?
other patients.
Hmm.
What
Yeah.
what is your alternate answer that you're thinking? Because you have something in your head. I can tell that you think.
No, I was honestly just trying to like eliminate them. Like it's
Mhm.
I wasn't. It's not A. I don't think it's D.
Okay, so
So
it's
I'd say I
between
do
B
think
and
it's C. That's my guess.
Yeah.
Okay,
Because you don't want to like if they like act out, like they haven't slept for
Mhm.
3 days.
Exactly.
They're already hypersensitive. We know that from the question before. So if you're trying to tell them like if you do that again, you're going to be placed in seclusion immediately. That's a threat.
mhm.
That's a threat to them. And I don't think that in this heightened state, they would do well with that.
all right. Number 9, it's all medication. What the?
All right, let's see. Consider the drugs Depakoto or what? Oh God, whatever.
I think it's,
Depakote.
yeah. Depakote,
Uh,
yeah.
Tegretol and gabapentin, which also belongs with this group.
Oh,
Isn't it Risperdal? Did I make that up?
I think it's,
so this I know for a fact
This is the
Depakote is for
mood
bipolar. I
stabilizer.
know that because I take that shit. That's for
My
bipolar. So what are which ones are also bipolar?
well
I
here,
think
so
it's the
actually,
L one.
Lamictal, you think?
Lamictal. I
it's
feel like I
not
learned that in clinical, but
it's not Abilify. I'm looking at my clinical care sheet for mental health. My patient is on like the D1 and Abilify. Those are
Mhm.
both one. The D1 is an pilopedic or whatever, the anti-seizure.
mm,
The Abilify is for schizophrenia. It's an antipsychotic.
Yeah.
And then
Risperidol is for schizophrenia, bipolar, and autism spectrum. So
Yeah.
Okay.
I'm in my notes under mood stabilizers. I have Lamictal right beneath Tegretol.
Lamictal, you said?
Yeah.
So you think B?
Yeah, I think B. The Lamictal, Lamictal.
Mhm.
Ultragene.
Yeah.
I'm
What do you
gonna
guys think, B?
I'm gonna trust you guys on this. I'm really not good with the
And it
meds.
says here lamotrigine is an anti-seizure / anti-epilepsy drug. Maybe I'm wrong because again, that's what my Depakote, these were migraine headache, acute manic or mixed episode, so with bipolar disorder or without. It's like, yeah, so that's. Let me see.
So what I found, it says these 3 drugs are all can be
Anticonvulsants,
used. Yeah, anticonvulsants, and then the lamictal is also an anticonvulsant.
Okay.
Okay, so B it is. Okay,
Cool.
sounds good.
All right.
Okay,
Moving on.
question 10. A client is diagnosed with bipolar 1 disorder. Current episode is depressed. The physician prescribes Paxil. Despite all efforts, the client's depression becomes profound and leads to total despair and a vegetative state. The physician obtains consent from the client's spouse to perform ECT. Which rationale does the nurse provide the spouse behind this treatment for profound depression?
Jeez.
Electroconvulsive therapy.
ECT. Let me Google that.
It's definitely not A. This is not like a quick fix. You know what I mean? And like they'll just be
Mhm.
fine.
I don't think it's C.
It's not, yeah. So it's not A and it's not C.
Maybe I'm leaning towards D.
ECT involves a brief electrical stimulation of the brain while the patient is under anesthesia. Okay.
We need to know if electroconvulsive therapy reduces causes stimulation to the central nervous system, or if it increases levels of the norepinephrine and serotonin. And I think
it's norepinephrine and serotonin.
yeah, let's see.
I didn't have anything really in my notes. I'm checking.
I'm
it.
looking at it right now.
hmm. So
I think I think you're right, Sam. I think it is the serotonin norepinephrine.
So I'm confused though. So on according to Mayo Clinic, it says ECT seems to cause changes in brain chemistry that quickly reverse symptoms of certain mental health conditions. I'm not like finding like any like actual, like it says like activity in your brain increases dramatically like with this treatment.
The only reason why I say it's not B is just because it says similar to CNS stimulant
Yeah.
medications, whereas why don't they try that first? Why would they go right to that therapy?
Okay, you're right. Here, you know what? Let me just like see if it just straight up increases these. Okay. Oh. So ECT okay, yeah, it's D. ECT appears to increase neurotransmitters such as serotonin and dopamine.
Okay.
It also increases BDNF, which is a brain-derived neurotrophic factor, which can help brain cells grow. So yeah, I mean,
So
No, if
D.
it increases serotonin and norepinephrine, I agree.
Okay.
yeah. So D.
All right.
All right.
A client recently admitted to the inpatient unit after a suicide attempt has been placed on a tricyclic antidepressant. In terms of medication, what steps might be taken to maintain the client's safety upon discharge? What
Okay, so
steps might be taken to maintain
I would say
client's
B.
safety?
yeah. So safety and their discharge, and tricyclic antidepressants are more for major
Yes.
and for major depressive disorder.
So what steps might be taken to maintain safety upon discharge?
So definitely not A, that's too long.
What is that again?
B, yeah.
B,
I'm leaning towards B.
encourage an increase in
Mhm.
fluid intake, yeah, and then eat food. Yeah.
Cyclic antidepressants. Is it something you have to drink a lot of water? I mean,
Well, with any medication, they want you drinking a
Uh-oh.
full glass of water just so it
Mhm.
helps with absorption. But what am I looking for?
Patient education. So no alcohol might make you drowsy.
I just like that B says only after visiting the primary care provider,
I agree.
which I think is the most
Provide a
client
1 week supply
safety
of medication with refill
upon discharge.
Yeah.
Because it gives them like a week supply, and you're also
Mhm.
like, you need to get more of this, like you have to visit this primary care doctor. And I know like a lot of like we saw some people get discharged, during our clinical, and they like scheduled appointments like for
Mhm.
them, and they're like, you have to go.
And I feel like with C and D in this case, this would be assuming that they're still on the medication, but you know,
Yeah.
if upon discharge, they're not necessarily going to be on the medication, right?
Hmm.
So I feel like C and D are just kind of assuming. I don't know, just kind of trying to rationalize removing those. I
I
don't even
don't think
remember if those are the side
diarrhea.
effects, honestly.
I
Yeah,
don't think diarrhea is a side effect.
No, I don't either.
It is a side effect.
Oh, it is?
Oh, it is?
Yeah, yeah, it says it right.
But
Yeah.
that has nothing to do with their safety. It's just diarrhea,
Yeah.
you
Okay,
know?
sure. I'm thinking dehydration, lack of electrolytes.
True. Oh,
Yeah,
true, true.
yeah.
All right. So what do y'all? What's everyone leaning towards? B, Bravo.
Yeah.
I'm thinking, yeah.
Okay.
The
All
nurse
right.
administers a medication that potentiates the action of GABA. Which effect would be expected? Reduced anxiety.
Yeah, I was gonna
Mhm.
say GABAs are
Because
right.
increased levels of GABA reduce anxiety. So
Mhm.
any like thing that's potentiating the action of GABA would reduce anxiety.
All right.
I agree.
D.
Very good.
Everyone agree? We good?
I agree.
Mhm.
Okay. 13.
Next.
A client recently, oh, sorry.
No, you're
I'm
fine.
just gonna
Go
keep
ahead.
going. A client recently admitted to the inpatient unit after a suicide attempt has not responded to SSRIs or tricyclic antidepressants. The client asked the nurse, I heard about MAOIs. Why can't they be added to what I am on now? Wouldn't adding one help? Which nursing statement is the most appropriate response?
Jesus. Oh my gosh. I don't know.
Hmm.
Okay, wait. Not responding. Whoa, okay.
So they're not responding to SSRIs or tricyclic antidepressants.
Jeez. Okay, why can't they be added to what I'm on now? Wouldn't adding one help? I know there's like a lot of like good that comes from combination therapy, but I wonder if
I don't think MAOIs I think they can't be combined with SSRIs.
Yeah.
wait, I was gonna
Yeah.
say, I remember from pharmacology.
Contraindicated with the use of MAOIs.
Yeah,
I
yeah.
I think it's
Can't, I
B.
thought, yeah, I was gonna say, can't they cause a hypertensive crisis?
Their co-administration can lead to
Yeah.
increased serotonin levels, which could cause serotonin syndrome, a rare but dangerous clinical condition. So which one is that?
And with serotonin syndrome, they can get hypertensive.
Yes.
So
And
it's
so I think it's B.
it's B. B is in Bravo.
B
Yeah.
is in Bravo.
Life-threatening condition called hypertensive.
All right, Sydney, sorry. For 14.
No,
you can
you're
go.
fine. Okay, a client began taking lithium for the treatment of bipolar disorder approximately 1 month ago. The client asks if it's normal to have gained 12 pounds since then. Which of the following is the most appropriate nursing response?
I think yes.
I would say C, because weight gain is common with
It is, yeah. And with how long? How long? A month?
Yeah, a month.
yeah.
Let's talk
I mean, it
about
kind of,
strategy
yeah.
for safely improving your nutrition. So that
And I feel like that's the most therapeutic response
Yes.
I
after,
agree.
because weight gain is a common
Yeah,
side
and so it's obviously not A, and it's obviously not B, because it is a super common side effect.
and I also feel like those aren't very like a nurse probably shouldn't
Would
phrase it
never,
that way.
yeah.
all right.
And then same with D. It's like, oh, there's not much we could do. It's like, yes, there is. Like, to
Mhm.
Yeah. It's better than
counteract
being
your
emotionally
medication.
unstable.
Yeah,
All right.
That's
I
just-
think C.
All right.
Charlie.
A client with schizophrenia takes an antipsychotic agent daily. What assessment finding would be most important for the nurse to recognize? Yeah.
I feel like it
temperature
might be
101, right?
temperature,
Fever?
yeah.
So respirations at 22, that's a little high, but
Yeah,
Well,
but
it goes to 24.
yeah.
So, yeah, I mean, 101, it's like not that bad, but
that's
like,
high. Excess salivation,
But isn't 101 in fever?
Antipsychotic.
Anything above 100.4
That's what it, okay.
is considered a fever. So actually, yes, because you know what? If you have a high fever and you have a fever for that long, it could cause damage in your brain.
Yeah.
So
Well, yeah, I wouldn't say the weight gain or the excess salivation. I don't believe.
it's not a side effect of schizophrenia.
Yeah.
I think it's a side effect of the antipsychotic though.
Oh,
The
But
adverse
it could just
effects of
be
psychotic medications range from
but that's not something that is like the most important that the nurse would recognize. It doesn't really matter. I definitely think, because think about it, like we go with airways are like our most important
Mm.
things. She's still within the respiration rate. And the weight gain is like not a big deal. And then it's temperature. You know, I'm finding examples that say like, you know, like 100.4, you know, is very concerning. But again, we know that anything past 100 point, I mean, sorry, not 100.4. I'm finding like 104 fever is a problem, but I'm not seeing like, I'm sorry, I can't even speak, but I'm saying we know that 100.4 is considered a fever. So anything beyond that, I think would be the most important thing that the nurse would recognize. Because
The only reason why
nothing could really come of that.
Yeah,
like
I'm
no
just
harm.
rereading the question back and it just says, you know, a client with schizophrenia takes an antipsychotic agent daily.
Mhm.
I feel like it has something to do with that for the answer. Whereas like I feel like, yeah, temp is important, but is it important in specific of taking the antipsychotic agent daily?
I see
but-
what you're getting at, Sydney.
I see what you mean.
Mhm.
Yeah.
For me, it's
What is the most-
most important one? I feel like in this case, like the most important of all of these four, right? I think is the temperature.
Me too.
Only because of the weight gain and the salivation, like those are side effects, but those aren't as
Mhm.
concerning side effects to recognize. Like they're not gonna necessarily lead to like a super serious
Yeah.
condition. I mean, weight gain eventually cardiovascular disease. Yeah, but
And 8 pounds in 2 months is like
it's
not
relatively healthy of a
concerning.
weight gain.
Yeah.
All right, so you want to go with the C?
What do you think, Sydney?
I can see both sides. I think it's tomato. So
Yeah. So
we're good.
what
I
I
am
found,
good with C2.
yeah, what I found to explain the temperature is that a temperature that high could be a symptom of rare but life-threatening oh my God, neuroleptic, whatever, malignant syndrome.
Okay, so C
okay.
it is. Moving on. We
All
got
right.
2 minutes.
Jeez. All right. Well, we're gonna make another
An
one.
aging client with chronic schizophrenia takes a beta adrenergic agent, propranolol, for his hypertension and an antipsychotic. Given the combined side effects of these drugs, which client teaching is the most important? Those can both cause orthostatic hypotension.
C.
Mhm.
So it's C.
Yeah,
All right.
rise slowly. Yep.
17.
A
client
client
with
with
depression-
depression.
Go ahead.
Sorry, Bella, go ahead.
No, go ahead.
Okay, a client with depression and substance abuse has an interrupted sleep pattern and demands that the psychiatrist prescribe a sedative. Which rationale explains why the nurse would encourage the client to try non-pharmacologic interventions instead? Well, I C makes sense.
I think A looks good.
I agree. I
Yeah,
think A.
yeah, A
Yeah,
makes
I'm
sense.
leaning A too.
Okay. All right, in the treatment of anxiety disorders, what is the indicated usage length for benzodiazepines? What is the abuse potential for this medication class? I might have to Google that because I don't know.
Benzos,
Benzo.
yeah,
I think it's short-term low. Because I feel like they're typically prescribed for short-term use due to their potential for tolerance.
I definitely agree short term.
And yeah, and potentially abuse as well.
So, okay, so
What is it indicate?
Or is it long-term high? Oh my goodness.
I thought it was short term high.
Short-term.
what is
No,
the
that's the one I have to talk
potential
about.
use potential?
We're going to start another meeting though. This one's about to time out.
Yeah, let me just
Can we use
let me
the same linker?
No, I think you have to make a new one.
Yeah, I'll just make a new one, and yeah, I'm just gonna go end it right now. Okay.
Okay.
Mhm.
Okay.
Okay.
See you guys in a bit.
All right.